Hello, everyone. Thanks for joining us. We have Dr. Carol Ray, who's a PhD from the University of Nebraska-Lincoln in Interdepartmental Nutrition, and she has a Master's of Science degree from North Carolina Agriculture and Technical State University in Food and Nutrition. She is a 1983 graduate from Spelman College with a Bachelor of Science degree in Chemistry. Her career spans over several fields, in which she'll probably go into detail in her speech. So, please join me in welcoming Dr. Carol Ray, who will be talking about stigma within the African American community. Thank you, Dr. Ray.
Thank you so much, Jeff. I really appreciate this opportunity to speak with you all. First, I want to go over the statistics about African Americans and mental illness. 13.2% of the United States population identifies themselves as African American or Black. Of those, over 16% had a diagnosable mental illness in the past year, and that was in about 2014. That is over 6.8 million people within the United States. This is more than the populations of Chicago, Houston, and Philadelphia combined. Misdiagnosis, inadequate treatment, and lack of cultural competence by healthcare professionals cause distrust and prevent many African Americans from seeking or staying in treatment. And when I talk about cultural competence, that is sensitivity to the patient's culture by the provider or doctor. Studies show African Americans are just as much at risk for a mental illness as Caucasians, yet receive substantially less treatment. According to the Health and Human Services Office of Minority Health, African Americans are 20% more likely to experience serious mental health problems than the general population. So most African Americans with bipolar disorder are going undiagnosed and untreated. Several factors have contributed to African Americans not receiving help for their bipolar disorder or other mental illnesses. And some of the reasons include, within the African American community, many people misunderstand what a mental health condition is and do not talk much about this topic. This lack of knowledge leads many in our community to believe that mental health conditions is a personal weakness or some sort of punishment from God. However, research has found that many African Americans rely on faith, family, and social communities for emotional support rather than turning to their healthcare professionals, even though medical or therapeutic treatment may be necessary. It is important to note that faith and spirituality can help in the mental health recovery process, yet a mental health professional may also be needed. It is important to keep in mind, though, that recently I told a friend about me having bipolar, and the first thing she said was, God can deliver you from this. Yes, I believe God can deliver me from this, but in my case, I do need medicine in order to keep myself healed and also healthy. African Americans may be reluctant to discuss mental health issues and seek treatment because of shame and stigma associated with such conditions. In our community, I've often heard many people referring to people who have mental illness as "you're crazy." So that's a significant term within our community. Previous research indicates that some African Americans may think of depression as the blues or something to snap out of. Socioeconomic factors such as lack of health insurance may also limit access to medical and also mental health care. About 25% of African Americans did not have health insurance, and that was around 2014 and 2015. I've cited two peer-reviewed journals and articles within this presentation, and the first one, it is entitled Barriers to Treatment Among African Americans with Obsessive Compulsive Disorder. Many African Americans are unsure about who to see or where to go as a barrier that had caused them to delay or avoid seeking treatment for their symptoms. Many African Americans are unaware that they have a mental health problem. And so within this particular study, many of the African Americans had statements about mental illness. And one was, I was afraid and I did not realize I had a problem. I was embarrassed. Getting this type of help has and continues to be like a sore thumb. And another one said, unfortunately, I do not have insurance, so my fear was that if I sought help, it would not be good because I could not afford it. The participants were also asked what prevented them from getting treatment. Among those who were providing the response, it was about 51 individuals, and they indicated that they did not realize they had a disorder or that there was a treatment for it. In the next study that I'm citing, it's entitled Overcoming Barriers Faced by African American Families with a Family Member with a Mental Illness. And so the first part of this particular article indicated obstacles that caregivers and also mental health consumers, which is those who have mental illness, also case managers and mental health board members. All of these were polled as far as the obstacles that they particularly see as far as mental health is concerned. So first is caregivers' obstacles. They indicated feelings of isolation, lack of guidance from providers, and then also high case manager turnover. Mental health consumer obstacles were poor communication between caregivers, providers, and also consumers, burnout of caregivers, concern for lack of insurance, lack of knowledge about mental health, mental illness, and then also medications. Case manager obstacles, lack of caregiver knowledge about mental illness, deficiencies due to exclusion of the family from treatment process, and lack of adequate community support for caregivers. And then the mental health board members, they cited their obstacles as social stigma of mental illness, lack of availability of services, and then also caregiver fears of the mental health system. Solutions to the obstacles, the caregivers cited that support groups for caregivers would be a solution to obstacle. Also increasing involvement of caregivers in treatment. An example, doctors should have a conference with the caregiver and the consumer on the consumer's diagnosis and treatment plan. Solutions to obstacles cited by the consumers, caregiver education about mental illness, improvement in communications between the caregivers and providers with regard to the consumer's medications. Solutions to obstacles for case managers, more caregiver telephone support services, support groups for caregivers, and then also more treatment centers for mental health consumers. And finally, caregiver education via classes, videos, and then also newsletters. Solutions to obstacles from the mental health board members, education of caregivers against the stigma of mental illness, more varied working hours for mental health staff, such as working in the evenings and weekends, increased education received by the provider, meaning more cultural competence. Again, sensitivity of the provider or doctor towards the patient. Excuse me. There are several obstacles that are faced by African Americans. The solutions cited provide insight into how the mental health system can be improved at the caregiver, mental health consumer, case manager, and then also the mental health board member levels. Stigma within the African American community cited in this presentation indicates the type of things that many of the African Americans go through when they have mental illness, or if one is a caregiver of those who have a mental illness. So my experience with mental illness, I was originally diagnosed as having a form of depression called obsessive neurosis, now known as obsessive compulsive disorder. And the meaning of OCD, they often call it, is when a person experiences repeated actions in order to feel normal. When I was first diagnosed with bipolar disorder, I felt terrible. I felt that it was a punishment from God. After being misdiagnosed with OCD, it was 11 years later when a clinician told me that I had bipolar disorder all along. I became a mental health advocate after my lowest point in my life with mental illness. It was the summer of 2011 when I did not have access to my medication. I tried to fill my medication but could not. The pharmacist said that I had a glitch within the membership portion of my insurance, therefore she could not refill my prescription. I did not tell my parents about this because I did not want them to spend the money on my prescriptions, as they were about or at least $200 each, and I had 4 prescriptions. As a result, a few days later, I fell into a mental crisis. I was put into a compromised position, and therefore I was arrested for that. I spent about 6 days in jail before being transported to a state hospital in Virginia. It took 6 weeks for me to recover. After recovering, upon the advice of my aunt, I began writing a book about my experience. And my book was published in 2017, and it is entitled PhDs Have Bipolar Too, My Story. As a result of my experience, I decided to advocate against the criminalization of the mentally ill. So therefore, I speak to audiences to bring awareness to this topic. And finally, you can find my book on Amazon.com. Thank you.